The following is a presentation on Tay Sachs disease. With respect to genetic and genomic competencies and how the RN can care for a patient with Tay Sachs disease, including their family history. This presentation is by Erin Lachenschmidt, Tanya Jackson, Shanna Johnson, and Jennifer Dzemske.
Tay Sachs is a rare genetic disorder that affects the nerve cells in the brain and the spinal cord. It is a progressive disease that means over time the disease gets worse. The gene that is affected is called the hexa gene. In Tay Sachs, this gene changes or mutates. This change or mutation causes the gene not to perform properly. In a normal hexa gene, this gene gives the cell instructions to make a specific enzyme. This enzyme helps to break down toxins that build up inside the nerve cell. In Tay Sachs, the enzyme that is supposed to be made is not made properly. So the enzyme cannot break down the toxins that are being built up inside the cell. This buildup of toxins are what cause the signs and symptoms of Tay Sachs disease. The most common type of Tay Sachs starts in infancy. Babies that are affected begin to show signs and symptoms anywhere from 3 to 6 months old. At that time, signs and symptoms are general. Development starts to slow and muscles begin to weaken. Motor skills like turning over, sitting and crawling are slowly lost. A characteristic of this disorder is an eye abnormality called a cherry red spot, which can be found on an eye exam. As the disease progresses, children have worsening signs and symptoms, such as seizures, hearing and vision loss, mental handicap, and paralysis. Life expectancy with this form is very low. Most children only live into early childhood. There is, however, a late onset Tay Sachs, which is very rare. It appears later in childhood, teen years, and early adulthood. Signs and symptoms are less severe, but include muscle weakness, loss of muscle coordination, and mental illness.
Genetic and genomic aspects of Tay Sachs disease. This disease is most common in Ashkenazi Jewish population. 1 in 27 members of this population has a carrier trait for the disease. When parents come together and both of them have the carrier traits or the recessive genes, there's a 25% chance that they'll have a child with the disease and a 50% chance that they will pass this trait along. Genetic testing for this disease is very important because there's no cure for this disease, only medical management. So genetic testing is very important for them. I have a picture of Albert Einstein here just to show that he is from that population of Jewish people.
How should the nurse go about obtaining genetic information? The first thing that can help is completing a thorough family history. The nurse should ask about the health history of first-degree relatives, such as parents, children, brothers and sisters, second-degree relatives, such as grandparents, aunts, uncles, nieces, nephews, and grandchildren, and third-degree relatives, such as first cousins. A pedigree with 3 generations shown is also helpful. It gives a more overall genetic picture and is very comprehensive. Next, the nurse should ask about heritage. Although Tay Sachs is a rare genetic condition, it is most common among people of the Ashkenazi Jewish heritage, which is of Eastern and Central European descent. It's also found in French Canadian communities of Quebec, the Old Order Amish community in Pennsylvania, and the Cajun population of Louisiana. When asking of heritage and ancestral questions, care should be taken, and the phrases such as country of origin, family nationality, or the family's traditional religion should be asked.
How the nurse can contribute to the provision of genetic and genomic services. First, recognizing and eliminating barriers to using genetics in practice. The number one barrier is the lack of perceived relevance to practice. That also goes with there's a lack of confidence and preparation regarding knowledge and the use of genetic information. There's a lack of knowledge regarding referrals and resources. And nurses also want more evidence supporting beneficial outcomes. If nurses don't understand or see this information that's provided by genetics played out in practice, they'll be less likely to engage with this information. Family pedigrees were thought to be useful way back in 1962 for managing chronic diseases and educating and making referrals to other healthcare providers. So understanding that this is useful in practice will also help push this agenda forward. One of the eliminators is that there are nursing researchers. They are generating evidence that supports genetics and personalized care for common and complex diseases and making it applicable to clinical practice. Another thing that nurses can do to contribute to the provision of genetics and genomics is recognize the benefit of these services. They provide personalized care, treatment, and interventions, empower patients to be more active in their care, encourage health promotion and preventative measures for care such as screenings, and like I said before, it's important in the management of chronic diseases. Education is the biggest thing that nurses can do to contribute to the provision of genetics. Because implementing change in the clinical practice is much slower than the discoveries of new developments, education is the heart of the matter. I learned that genetics and genomics education is now mandatory for all BSN, MSN programs. And to help with education, there's an organization called the International Society of Nurses in Genetics. This is an organization that has a plethora of resources available online. I have the website here to help educate nurses about the push for genetics and genomics in care. And listed here are the skills that are needed to be a contributor. This comes from an article called Genetics and Genomics in Nursing Has Arrived. The ability to collect and analyze data from a 3-generation family history and construct a pedigree. That is a very important factor for nursing to be able to do. Identify patients at risk for heritable diseases and understand this implication. How will that affect the patient and the patient's care? Provide appropriate referrals and credible resources. That's one of the barriers that keeps nurses from using genetics, but is a contributor to pushing this forward. Provide patient education, such as screening, and discuss legal, social, and ethical issues, being comfortable with that. And again, just being a patient resource and an advocate.
This slide outlines the basics of the RN role regarding caring for a patient with a genetic disorder. The following slides will detail more information. It is important for the RN to be able to collect accurate information by use of the electronic health record and be able to interpret that information to find cues which may indicate risk for a genetic disorder. According to Berry and Workman 2012, the red flags of genetic disease which can be noticed during collection of family history are history of congenital abnormalities, exceptional presentation of common conditions, neurodevelopmental delay, exceptional pathology, and surprising lab values. By using informatics correctly and being on the lookout for red flags, a nurse may make appropriate recommendations to a patient on whether or not they might consider a genetic referral based on their family history.
Nursing role for those at risk for Tay Sachs disease. The nurse's role is to be able to obtain a family history of up to 3 generations and also to be able to construct a family pedigree. The family pedigree is important in helping to identify a pattern of genetic disease occurrence and single gene disorders and even more complex disorders. Informing and educating patients regarding the importance of genetic testing, especially for those of that population of Jews. These patients will need to know the importance or significance of genetic testing as it relates to the probability of having a child with this disease and the chance that their child could be a carrier. If the mother is already pregnant, parents may want to have the baby genetically tested, but then the nurse's role in that is to be ready to discuss the ethical, social, and cultural issues that come along with that testing. For example, if the child does have Tay Sachs disease, what would be the next option? Some would say abortion and some would say not. The other role for the nurse for a person at risk for this is to be an advocate and a help to make informed decisions. And on the side here in this slide, we also have links to websites that more information can be found, and also a link for if they're searching for a genetic counselor.
As an RN nurse generalist working with a patient dealing with or possibly dealing with a genetic disorder, it is important to provide unbiased information about genetic testing, genetic carrier status, possibility, and at all times provide that information unbiased and without your opinion influencing the discussion. You want to discuss options in advance of the test being done about what would happen if the test were positive. Remind the patient the test is not mandatory, but make sure all information is available so that they can make their own decision. Always ensure that patients are not being coerced into genetic testing. If they do decide to see a genetic specialist, you can offer to be present during that discussion if it makes them feel more comfortable. And it is always important to discuss the pros and cons of genetic testing before the genetic testing occurs. Options such as adoption, sperm or egg donation, and more recently, according to Barlow, Stewart et al., pre-implantation genetic diagnosis is possible. It gets into a tricky area when you consider different patients who are trying to have children, considering their own philosophical and religious beliefs in this decision and discussion. This concludes our presentation. I hope that you now are able to understand the definition of Tay Sachs as a genetic condition.